Welcome to Open BXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter and BronxNet Community Television on Facebook. As we know, the Bronx has been hit hard by the coronavirus pandemic. And while age was a major factor in COVID-19 deaths, neighborhoods with high concentrations of Black and Latino people, as well as low-income residents, suffered the highest death rates. To help us understand how and why COVID-19 has disproportionately affected the Bronx, a local doctor recently wrote a piece breaking down the often forgotten relationships between systemic injustice and health. Joining us now to discuss is Dr. Vanessa Ferrel. Dr. Ferrel, thank you so much for joining us today.
Yeah, my pleasure. Thank you for having me.
Of course. So first, to start off, I just want to learn more about you and your work here in the Bronx as a doctor.
Sounds good. So my name is Vanessa. My pronouns are she, her, they, them. I'm a medical doctor, public health professional. I moved from Southern California to the Bronx 2 years ago after graduating from med school to do a postgraduate training in internal medicine. I love being in community with the Black and Latinx people like across the borough, and I believe that our shared identities really allow for a more holistic and accessible patient-doctor relationship. That being said, I do recognize my position as an outsider who's living in the Bronx and how my presence as a physician can be kind of a double-edged sword for Native Bronxites. As an activist, I firmly believe that health equity and intersectional justice are goals that we should be seeking kind of perpetually in order to optimize the health and the lives of our communities. I believe in people power and I believe in community power.
Thank you so much, Doctor, for your transparency and for bringing that up. I wanted to ask, in the Bronx, we have, of course, the highest asthma and diabetes rates. In your powerful piece for Left Voice titled Structural Violence, COVID-19 in the Bronx, you broke down how social determinants and environmental racism relate to the existing Bronx health crisis and the highest rates of coronavirus. Can you please help us break this down a little bit more?
Yeah, no problem. So as you mentioned, I recently wrote this piece in Left Voice, basically just about what it was like for me as a Black doctor to treat kind of this explosion of COVID-19. So in the piece, I examined some core themes of structural violence like racism, capitalism, xenophobia, white supremacy, and how they perpetuated the devastation here. I think that racism and capitalism invariably go hand in hand as culprits of high rates of asthma, diabetes, and other chronic medical conditions in our communities, both here locally and nationally. And given that this is a respiratory pandemic, I'll kind of start with disparities in asthma. May or may not be widely known, but the Bronx has the highest rates of both teenagers and adults who have ever been diagnosed with asthma. And I think that there are different levels of just structural violence that contribute to that. So part of it is like the physical environment. So thinking about how the I-95 and the I-87/I-278 just kind of course through the Bronx and connect multiple parkways and highways and allow for like diesel trucks and other cargo trucks to carry materials between other cities and states, and seeing how like this increased traffic generates air pollution where these trucks are going from like industrial plants that like line the South Bronx and increase exposure to different pollutants, including PM 2.5, which is fine particulate matter, as well as ozone. And that exposure in and of itself creates conditions that make people more vulnerable to developing asthma. And it also contributes to the difficulty in controlling asthma to the extent that, like, on average, twice as many emergency department visits and hospitalizations are experienced both for children and adults that are attributed just to these disparities in pollutants, the PM 2.5 and the ozone. And I think, like, moreover, you know, the fact that these freeways are kind of interrupt like residential spaces and outdoor spaces is absolutely not accidental. A lot of it even has to do with like this early 20th century practice of redlining, which designated 80% of the borough as either definitely declining or hazardous. And so for people that are unfamiliar with the practice of redlining, it first emerged as a predominantly like fiscal practice wherein these like residential security maps were generated basically to classify the riskiness of giving like money as in bank loans or mortgage loans. And they were color coded based on the neighborhood as like green to red is the riskiness. So inevitably, neighborhoods that had a higher proportion of Black people or immigrants received lower grades, indicating that like loaning money was very unadvisable. And so even beyond like urban planning and redlining, more Bronx residents report like vermin infestation, including cockroaches and mice, compared to other places in New York City. And I think that that is directly linked to the decades of disinvestment from the state and local governments, who overall prefer to ignore the health and well-being of poor and Black and brown people instead of fixing the problems the system itself created.
Wow. Thank you so much, Doctor, for breaking that down. I know that that's a conversation that we all should engage more in. The fact that our health here in the Bronx is also attributed to other systemic factors as well. And I think that your piece really breaks that down. And I'll definitely provide the link at the end of our segment. But I also wanted to speak about why the fight for health equity and intersectional justice within the health system is just as important, and how these things relate to the current civil unrest of many Bronxites who stand in solidarity with National Black Lives Matter and anti-police brutality and police reform movements. How can we tie these things together?
Yeah, I mean, so I think to start with, like Black Lives Matter, period. And I think that medicine and public health are microcosms of society. And so things like anti-Blackness and racism and capitalism and xenophobia and white supremacy are inherent of the fabric of the profession, the same way that they're inherent in the foundation of society. And so I think that healthcare workers need to kind of come to that realization and accept that. And we've definitely all heard these horror stories of Black people, especially being mistreated or ignored in the clinical setting and having some really tragic outcomes. And I think that, it's fair to say that just as with police violence, there are cases of medical violence that don't make it to the mainstream news, but violence toward Black, Indigenous, and other people of color are all inherently connected. And speaking to police violence specifically, I think we have to move past this idea that the institution of policing can be reformed. The police, as we know them, were founded from coalitions of slave catchers, night watchers, and so it would be really irresponsible to ignore that history and ignore that context, because anti-Black racism is like literally built into the foundation of the institution of policing. So we can't simply reform that. The solution is invariably abolition. And I think that like Black abolitionists have been advocating for the abolition of police, of prisons and detention for so long. And it's really invigorating to see the movement start to turn in that direction. But I fully support the uprisings locally and nationally.
Dr. Ferrel, you also spoke about the Bronx and its historical solidarity against corrupt and racist medical care. Can you help us also visit that topic?
Yeah, definitely. So I think one of the guiding examples and kind of one of like the examples that I feel most aligned with, and something that I always kind of keep going back to regarding fighting corrupt and racist medical care, the Young Lords, who were founded within New York City in the late 1960s as a Puerto Rican liberation organization that worked closely with the Black Panthers in the interest of Black and Latinx solidarity and liberation. And some of their efforts, especially toward the beginning, centered on Lincoln Hospital, which is in the South Bronx, and at those times was known by many people in the community as the butcher's shop, because of how like poorly the health outcomes were for people that were admitted, and how people either left the hospital worse than they came in or died in the hospital and never left. And so the Young Lords successfully like took over Lincoln Hospital on at least 3 different occasions in 1970. So I think there were a lot of successes within them, and they were often generated as like responses to actions that had happened in the community, or inequity that had happened in the community. And so on one occasion, they issued 7 demands to Lincoln Hospital. On another occasion, they established the People's Program for heroin recovery services for the community. I think that the Young Lords really understood the power of organizing and used their skills to advocate for the entirety of the South Bronx. And I think importantly, they also understood that health was more than just direct medical care or caring for acute illness, which is really evidenced in a few of their 7 demands, like demanding fair wages for hospital workers, demanding preventative care services, child and elderly care to be offered by Lincoln Hospital, as well as the establishment of a community-driven Lincoln Hospital, kind of this idea of community control of facilities.
Thank you. I also wanted to discuss some of the hardships that you face as a Black physician on the forefront of this crisis. How are you trying to balance the equity and disproportionate health realities facing our communities?
Yeah, so I think medicine, as mentioned earlier, is like this inherently racist field and an inherently anti-Black field. And I think it's really challenging to balance that as a Black physician. And I think that there's so many different levels of racism that as going through training and medical education in school, what you're taught, the way that we're kind of conditioned to think things like, as doctors, this is what you think about Black people, or this is what you think about Latinx people or Asian people or Indigenous people. And that being tested and standardized tested, and just kind of these different ways that this gets perpetuated, and kind of, that being very clear that medicine has a field that was created by white people, with the intention of othering everyone else, and this idea of white superiority that still gets perpetuated in medical research now, and even things like race as a social construct, which is very well recognized by critical race scholars, but still within medicine is this thing that race as a biologically, genetically determined thing that creates inherent pathology or vulnerability in people who you look at and assign a race to, which is, not very scientific at all, but it's kind of just, it is everywhere within medicine. And so I think for me, something that's been helpful is to be somewhere where my patients look like me and my family members, and kind of keep me grounded in order to kind of counterbalance the immense othering and alienation that comes with just being a doctor or being in medicine.
Right. I know that you're also part of a group of healthcare workers who put forward a powerful statement in solidarity with actions against police and racist violence, demanding justice for George Floyd, Breonna Taylor, Tony McDade, Ahmaud Arbery, and Sean Reed. Can you tell us more about the healthcare workers' call on the labor movement to take action against police and racist violence?
No problem. So this was a collaborative effort among socialist healthcare workers across New York City, who recognize that racism is a public health crisis and that the police are a threat to public health, and that white supremacy is a threat to public health. So it essentially serves as a call to action for healthcare workers across the country and across the world, to condemn anti-Blackness, to condemn racism, to condemn white supremacy, to condemn the institution of policing. In the letter, we outline our major ideology, which includes we condemn racist enforcing of social distance measures in Black and Brown communities, that we believe healthcare workers are working class and should stand in solidarity with Black and Indigenous-led movements, especially during the pandemic, that we denounce professionalism and dual loyalty, that we denounce worker expendability under racial capitalism, especially under COVID-19, and that we stand in solidarity with actions against racist violence. And so really the importance of recognizing racism as a common thread within not only society, but in our professions, and how important it is to be activists and stand in solidarity actively rather than kind of this passive, non-event, in order to meaningfully take action against racism and other forms of oppression.
Is there a fear in the healthcare community to, I guess, go against the status quo and the structure that's already set in place, or the systemic issues that are set in place at hospitals? Is there fear amongst colleagues that you sense, or I don't know, some kind of pushback when it comes to these type of things?
Yeah, I mean, there's absolutely pushback, and I think that that's part of what the inherent nature of medicine is, and why it's so difficult, so challenging for me as a Black person who's an activist, who's with radical politics, because all of those things are directly in conflict with the institution of medicine. And so much of medical education, especially, so thinking about medical school, getting into medical school getting through medical school, going through training, and being successful in academic medicine really require you to like stick to the status quo and not challenge it because of fear that your career can be compromised anytime that you speak out. And so I think that often the like anyone who's kind of on like the like passive side will go toward just keeping things comfortable in order to not make their future challenging.
Thank you. One final thing, Dr. Ferrel, just a message for the Bronx community on solidarity and health.
Yeah, so I think that there is a just historically beautiful spirit of organizing and community care that lives on in the Bronx. I want to particularly shout out two orgs, Take Back the Bronx and La Morada, the restaurant in South Bronx, who have been supporting the South Bronx, especially during this pandemic. Just kind of these principles of like feed the people, fight the power. I think that we need to continue to hold each other up and to organize against the systems that seek to oppress us and seek to marginalize us. And remember that the pandemic is not over, and the only way out is through.
Thank you so much, Dr. Vanessa Ferrel, for your time today. And definitely shout out to La Morada and shout out to Take Back the Bronx for their work in our community.
Thank you. Thanks for having me.
Of course, thank you. Folks, to read Dr. Vanessa Ferrel's piece on structural violence, COVID-19, and the Bronx, please visit leftvoice.org and type in Bronx. The title should pop up. Open BXRx will be right back.